Erectile dysfunction, ED, is a common condition among men, and it can be a source of stress, anxiety, and embarrassment. Many men turn to natural remedies and prescription drugs to treat this condition. However, the question remains, which treatment is better, natural or prescription? In this essay, we will examine both types of treatments and argue that prescription treatments are more effective and safer than natural remedies for ED. On the other hand, prescription treatments for ED are well studied and are proven to be effective in the vast majority of cases. These treatments include medications like sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra. These drugs work by increasing blood flow to the penis, which helps to produce and maintain an erection. They are regulated by the FDA, which means that they are subject to rigorous safety and efficacy testing. One argument often made in favor of natural remedies is that they have fewer side effects than prescription drugs. While it's true that some natural remedies may have fewer side effects, this is not always the case. In fact, many natural remedies can have dangerous side effects when taken in high doses or in combination with other medications. For example, yohimbe, a natural remedy sometimes used for ED, can cause high blood pressure, anxiety, and heart palpitations. Natural treatments for ED are often marketed as herbal or all-natural remedies. These remedies include ginseng, L-arginine, yohimbe, and acupuncture. While some of these remedies may have some anecdotal evidence of effectiveness, there is little scientific evidence to support their use. In fact, many of these natural remedies are not regulated by the FDA, which means that their safety and efficacy are not guaranteed. Another argument in favor of natural remedies is that they are more affordable than prescription drugs. While this may be true in some cases, it's important to remember that natural remedies are often not covered by insurance. Additionally, many natural remedies require regular use, which can quickly add up in cost. Prescription drugs, on the other hand, are often covered by insurance and can be purchased at a reasonable cost with a prescription. Finally, it's important to note that prescription drugs are often the only effective treatment for ED in severe cases. While natural remedies may work for some men with mild ED, they are unlikely to be effective in cases of severe or chronic ED. In these cases, prescription drugs may be the only option to restore sexual function and improve quality of life. Is it safer to try a natural remedy rather than a prescription? While natural remedies may have fewer known side effects, they are often not subject to the same level of regulation and testing as prescription medications. This means that their safety and effectiveness may not be well established or consistent across different brands and products. In contrast, prescription treatments for ED are subject to rigorous testing and regulation by the FDA. This means that they have been shown to be effective and relatively safe when used as directed. However, they do come with potential side effects and risks, and should only be used under the guidance of a healthcare provider. Ultimately, the choice between natural remedies and prescription treatments for ED depends on a variety of factors, including the severity of the condition, the underlying causes, personal preferences, and any underlying health conditions or medications. Men with ED should consult with their healthcare provider to determine the best course of treatment for their individual needs and circumstances. In conclusion, while natural remedies may have some anecdotal evidence of effectiveness, prescription drugs are more effective and safer in treating ED. Prescription drugs have been rigorously tested and regulated by the FDA, and they are proven to be effective in the vast majority of cases. Additionally, prescription drugs are often covered by insurance and can be purchased at a reasonable cost. While natural remedies may be appealing due to their lower cost and perceived safety, it's important to remember that they can have dangerous side effects and are not subject to the same safety and efficacy testing as prescription drugs. Therefore, we recommend that men with ED consult with their healthcare provider and consider prescription treatments as the first-line treatment for this condition.